30-year-old Mary Royster lives and works in San Francisco.
I live in North Beach, and I walk to work, which is awesome. And when I go to work, I look forward to going to work.
But that all changed recently when Mary noticed something was wrong with her nose.
I noticed kind of like a little flakiness on the side of my nose. It was just a little uneven spot that wouldn't go away. So I went to the doctor and had it checked. And I was diagnosed with basal cell cancer, which is, from what I understand, the most common form of skin cancer, and millions of Americans have it.
In an 8-hour procedure, dermatologists removed the tumor.
I was completely hysterical when I got out of there. I was left with basically a disfigurement. It definitely is just really hard to look at. Sometimes people ask me, you know, what's going on and stuff. I came up with a couple good stories, you know, like saved a cat from a tree, hit every branch on the way down.
Mary decides to consult with Dr. David Kim about nasal reconstruction.
Hi, Mary. I'm Dr. Kim.
Nice to meet you.
Nice to meet you. I know you've kind of gone through a lot. If you don't mind, I'd like to take a look here.
Okay.
Is a pretty deep defect. It goes through the cartilage. We're going to have to replace the missing cartilage here with cartilage brought in from the inside of your nose. Once we place that cartilage here, then we'll have to bring some skin, and the best place for that is the forehead. Mm-hmm. We're going to make an incision above your eyebrow, come across and come down. And this flap, which contains skin, muscle, and some fat, is going to be rotated down to close off that defect. The reason we do it this way is there's a small artery. By rotating it down and the artery being preserved within that flap, it can nourish this reconstruction with blood supply while it's healing. Okay. The difficulty is that you think of the skin that's up here that rotates down. It's going to be sutured in this area, but there's going to be a stalk or a connection that's still connecting. Yeah. 3 weeks later, after things have healed in the lower portion, we can then cut the stalk off, thin it a little bit so it matches the contour of the nose a little better, and then repair the area where the stalk was connected. Okay. Does that make sense?
Yeah.
It's the day of surgery. Before the operation, Dr. Kim uses a Doppler device. This instrument helps him locate the artery that will feed Mary's skin flap.
Did you hear that pulse? It's a good, strong signal, so that means there's definitely a nice artery right there. So what I'm going to do is just kind of mark out some of the lines of the incisions that I'm going to have to make here. I know it's a scary moment right now, but you know, you got to look ahead, because this is the last time you're going to have to look in the mirror and see this big defect there. Okay. You doing all right? All right. We'll see you in the room, okay?
Okay.
Mary's a really resilient girl, and I know in the last several days she's had a great attitude, has been very brave, but I think all these things have sort of caught up to her. She realizes that she's finally going through with it, and what happens now in the next few hours can really impact how she's going to live for the rest of her life.
To begin the procedure, the doctor must find healthy cartilage.
I have to replace that structure, otherwise she's going to have sort of a divot here. So I'm just freeing up the cartilage now from the nose. Fortunately, in Mary's case, she does have abundant cartilage, and the cartilage is fairly strong.
Next, the scar tissue on the edge of the wound is removed.
The flap will do better and heal better if it is able to heal onto healthy, normal tissue rather than scarred tissue.
To restore the underlying structure of Mary's nose, the harvested cartilage is trimmed and put into position.
So it's a pretty good fit. The top of it blends in nicely to the nasal bones. The bottom of it blends into the lower cartilages.
Using a foil imprint, Dr. Kim creates a template of the defect.
We have to turn it upside down to design the flap in the forehead. Then I know with certainty that the size and dimension of the forehead tissue is going to perfectly match what I need to close the defect in the nose.
Precise incisions free the flap while leaving the artery intact.
We want to keep this artery preserved. This is called a pedicle. A pedicle means the bridging tissue that's still connected to the artery. We want the artery to stay contained within the flap so that it'll nourish the area that's going to heal in the nose.
To minimize scarring, the forehead is sutured closed in multiple layers.
The next phase is to inset this flap. This is a really bulky piece of tissue, so we have to thin it out so that we end up with about the same contour.
Dr. Kim must trim the tissue carefully. Cutting too much could endanger the blood supply to the flap.
Now this is a balance. The more thinning I do, the more delicate the nose will appear.
To reconstruct Mary Royster's nose, the doctor faces a tremendous challenge. He must strike the right balance between contouring the tissue and maintaining a healthy blood supply to the flap. If he cuts too much, the blood supply will be jeopardized and the tissue could die.
In total, over 60 stitches are used to contour the flap.
As we're doing this, we have to inspect the pedicle or the skin flap. As I push on it, it blanches, but then it pinks up right away. So I think we have reason to be very optimistic about the outcome here. Overall, the procedure went really well. In 3 weeks from now, we'll be ready to divide this pedicle or the connection to the forehead. We'll discard the majority of it. We'll then be able to suture the final side of this rectangle that's going to complete the nasal closure. Hi, Mary. You doing okay?
Yeah.
Just wanted to let you know that everything went perfectly. No problems whatsoever. So if you want to look in the mirror, you can see that the tissue is fairly pink. So that color is a good indication that that flap is happy. So I think you're going to do great. I think you're going to do really well.
Mary Royster's cancer left her disfigured. Will plastic surgery restore her nose? 30-year-old Mary Royster was diagnosed with basal cell skin cancer on her nose. The tumor was safely removed, but she was left with a gaping hole.
I was completely hysterical.
In a 4-hour procedure, a flap of her own forehead skin and tissue was used for her nasal reconstruction. When the flap had healed, Dr. Kim performed a second procedure to further contour her nose. 10 weeks later, Mary returns to Dr. Kim's office.
Hi, Mary.
Hi,
how are you? You look really good. Yeah. So as I look at this forehead scar where we took the flap from, all we have now is just this vertical scar, and it's really healing great. And when I touch the flap here, it feels just like surrounding tissue. It's warm, it has good color. With a few more months, it's really going to be almost perfectly flat. So a year from now, we're going to have the opportunity to make it even better. And I think for someone who's never met you before on the street, it's going to be really tough to even know that you've had anything done.
I did fear that I was going to be permanently disfigured, but I'm amazed. I didn't think that at this point it would already look this good. I do feel like I got my life back. I feel like I'm doing the normal stuff that I used to do. I don't feel like I'm trapped in my house. You know, for a while I did feel like that. I feel very lucky. I do realize that I'll never look 100% the same, but I guess I'm an optimistic person because, you know, compared to how I did look, I'm happy. 2.5 months ago, I had a hole in my face, and now I feel total relief that it's gone, and I could have been disfigured, and now I feel like I look pretty normal.
Mary Royster clearly had an amazing result.